Young as 6 months old are now eligible for the same updated COVID-19 booster shots already available to other age groups. Here to answer your questions, Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Good to see you, Dr. Moffitt.
Hey, Dr. Moffitt. It's great to see you.
Good to see you.
So let's break that down a bit. The CDC authorized the latest boosters from Pfizer and Moderna for children under 5. So what else do parents need to know about the dosing?
Yeah, so the dose here for the Moderna bivalent vaccine for those 5 and under is only 10 micrograms. So that is a dose reduction compared to the primary series. For that age group, the Moderna primary series was 25 micrograms per dose. The Pfizer bivalent booster dose for those 4 and under is 3 micrograms, which is the same dose as the primary series for those young kids getting the Pfizer primary series.
Okay, and as you know, and you kind of just mentioned that these shots were developed to protect against the Omicron variants, the BA4, the BA5. We've got different strains now kind of circulating out there. So how much protection do these shots actually offer?
Yeah, it's a great question. And as you mentioned, the predominant strains circulating right now actually are the BQ1 and BQ1.1. Omicron subvariants that account for about 60% of cases here in Massachusetts. The BA5 is accounting for about 13% of cases. But both Moderna and Pfizer have demonstrated in older children and adults that their bivalent boosters, so they end up eliciting significantly higher antibody responses even to these BQ subvariants compared with their original vaccines or their original vaccines used as boosters. So it's really based on that data as well as continued very reassuring safety data around these bivalent vaccines that FDA made this authorization for the youngers to get these bivalent vaccines.
Dr. Moffitt, let's talk about the flu and RSV because it's been very much of our conversation for what, a month now, 6 weeks? We know an early surge of both viruses is putting a big strain on hospitals. Anecdotally, what's the situation at Children's?
Yeah, we really did see our earliest surge even really right through all of October with a dramatic rise in peak in RSV cases. That did seem to peak in about mid-November. We have been seeing decreasing numbers of RSV cases over the last couple of weeks, but that's really not been associated with any relief at children's hospitals or just, I think, really hospitals nationwide, because at the same time, we've seen a drastic increase in influenza cases. And that is still on top of very steady cases of COVID-19 infection as well as other respiratory viruses. So we're still really feeling it.
You labeled it a drastic increase. Interesting.
Yeah.
And speaking of the flu, RSV, we know there's no vaccine yet for RSV, but there is one for the flu. What do you want parents to know about scheduling a shot?
Yeah, we had an early report from the CDC that this year's formulation of the influenza vaccine seems to be a good match for the flu strains that are circulating right now. So that is very good news, because in years when the flu vaccine has turned out to even not be a very good match, it still has offered substantial reduction in the likelihood of influenza hospitalization or severe infection with influenza. So hearing that so far it's a good match is great news. I also would just encourage those who've not yet been vaccinated to remember that we typically see more than one surge of influenza every season. So even if this is surging, we haven't even seen the peak of the current influenza surge. So numbers are still likely to really, really be on the rise. It is not too late at all. Now would be a great time to get your flu shot. We expect to see transmission sometimes right even through March. And I would really encourage people to do it, especially before they plan on gathering for the holidays, which is coming up very soon based on how many cases we're seeing right now in such a rapid rise.
And the holidays are right upon us. You know, Hanukkah starts this weekend, Christmas being a little over a week away. Dr. Moffitt, thank you so much. Great to see you. Have a great weekend.
You too. Thanks.
Thank you, doctor. And to our viewers, if you have COVID-related questions that you'd like our experts to answer, you can email them to ask@wcvb.com.